200. How you doing? Fall 2020. Today's September 14th, 2020. And there's your co-instructor. Okay.
Hey guys.
Super brilliant. Is it okay for me to say you're beautiful
Oh
too?
my God.
She's my wife. Why not? Why not? Okay. But super brilliant and accomplished,
Uh-huh.
and is actually preparing for a lecture. She teaches a law course at USC. Yes, she is an attorney. I brought her in today. First of all, you are interacting with her constantly. She is the nuts and bolts behind this class in terms of the communication that's essential. So a lot of you already know Julia because you've been communicating with her. And we're going to go straight into our topic. I do want to remind you, okay, you see that's TT1 due today, okay? And all the instructions are in there. I'm not going to go over it again. I sent it in my last email, but just remember, if you're having any issues, you communicate with her, okay? And she'll walk you through it and get you through it. But importantly, we're going to go into this week's assignment, okay? So we discussed theories of aging last time, and I talked a little bit about nutrition, and we're going to discuss that again today. Just as we're going to learn about oncogenes, and these are drivers of cancer, and nutritional status is a big part of that. Okay, today we'll go right into the cancer module. Today is Monday, and I like to get the lectures done oftentimes on Sunday, but we couldn't do it yesterday because what happened yesterday?
I was getting an infusion at the cancer center
That's
because I am a cancer patient, and this subject is near and dear to my heart, just because it's really interesting and it also affects me personally.
Right, right. And so it affects a lot of you guys personally as well. I mean, the reality is, the estimates are for you over your lifetime. And of course, a lot of you are going to live longer, and the biggest risk factor for most cancers is longevity or getting older. But 1 out of every 2 to 1 out of every 3 of you will get cancer in your lifetime. And so, so there's a lot of things you can do to prevent this, in terms of exercise and health and not smoking, getting your HPV vaccination, on and on, all these kinds of things. No IV drug use, all these things are put you out there in terms of risk. But there are at times, it's just a matter of your genetics. It's a combination of environment and genetics. So in this particular module, what we want you to do is you read through this. Like I said, it's a very scary diagnosis. So like I said, 1 out of every 2, 1 out of every 3, and I'm sure a lot of you have had to deal with being a caregiver for a cancer patient, whether it's a friend, your parents, or your grandparents. It impacts you directly or indirectly, and it's a big deal because it's a very, very aggressive cancer. Aggressive disease, excuse me. So we want you to go in here and we want you to navigate the course and the website that we have. This is a great government website, cancer.gov. So you just click on it. I'll get my face out of the way here. And what we want you to do, as indicated in the prior directions, we want you to scroll. I mean, feel free to show some curiosity. This is kind of just very newsworthy things that are happening in terms of cancer research, in terms of cancer treatment. But we want you to learn about cancer. So there's just a little bit of reading right here. So you click right here, and it takes you to what is cancer, all right? And so it talks, very concisely for the general public, what cancer is, the difference between cancer cells and non-cancerous cells, the need for, the cancer grows so fast, we need tons of blood vessels. Yeah, again, I'm not going to read this for you, but it really comes down to, we'll show, we highlighted this in a cartoon. That's my son. So we highlighted this in a cartoon where there are 2 categories of main genes, unlike cancers. And yes, cancer is a genetic disease that can be pushed in one direction or the other direction based on some of the environmental choices that I talked about, like diet and alcohol use, and whether or not you've been exposed to a virus like the HPV virus. Okay, so but it ultimately comes down to the changing of the genes, and that's what's shown right here. And it can become a gene that is just grow, 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 grow. Okay, it's like a pedal to the metal gas pedal, right? Um, and these are called oncogenes. We have normal versions of these genes are called proto-oncogenes. Because we have to produce new skin cells all the time, new colon cells all the time. There's this constant turnover. You just don't want the turnover to be 1,000 times faster than normal. That's when you convert from these normal genes that make new cells to genes that are called oncogenes. Okay, so you go from the proto to the oncogene. It's just naming. That's all it is. And the other class of gene is the tumor suppressor gene. And we have the capacity in ourselves to say, you don't look right, we're going to take you out. Okay, and so we try and kill off the abnormal gene cells that have mutations, but cancer is nefarious and has developed these genetic strategies to keep that from happening. So you keep these bad cells around that have mutations, they divide, and then boom, new mutations, and that's why cancer becomes so aggressive and so hard to teach. All right, so I've said it all in a nutshell, and I just kind of want you to kind of go through this and just kind of read through it. Okay, so the most common that's out there is a carcinoma. Okay, this is, as indicated, an epithelial cell. So these are kind of cancers you see, for example, in breast cancer or colon cancer or that type of cancer. And then these are much rare, much more aggressive. Connective tissue muscles, that's the sarcoma. And then we come down here to the cancer that's affected Julia. It is a lymphoma that has now progressed into what's called a lymphocytic leukemia, and that is your immune system. And so it's really hard for her right now in terms of the COVID-19 or the SARS-CoV-2 pandemic, and that she has an extremely compromised immune system that will not fight off this virus because her immune system, which is the white blood cells that is part of the leukemia condition, her particular type of cell is a lymphatic cell. Mm-hmm. Just doesn't work right, and so the virus can overwhelm her body, and she could die. So we're being very, very careful.
And so, just so you know, if you have a relative with cancer that is immunocompromised, because quite often in treatment, no matter what kind of cancer you have, you become immunocompromised as a result of treatment. It's very simple how to deal with it. You wear a mask, you avoid sick people, you wash your hands a lot. You know, it's not rocket science. There's very basic, easy public health steps we can take to protect ourselves when we are vulnerable.
But it's difficult too. You know, as I said to you guys out that article, you know, your age group, you know, it's extremely difficult because you're being driven to separate yourself from our generation, to become independent, to find the new Mrs. Walsh. You know, if I was 18, I'd be trying to find Mrs. Walsh. You know, I found her, so I'm not going out. I'm not carousing.
So we're good. We're staying home.
I'm not going to bars. Okay, it's not. I'm not going to any Sigma Chi parties. I promise you. Okay, all right. That's the reality of that. So and then if you have a particular cancer that has impacted you directly, then go ahead and look here. So for us, we would click in here and we would check out, because knowledge is power when it comes to disease, and especially cancer. And the more you know, and the greater the advocate you can be for your best health care. For me as her caregiver, let's say it's your grandparents, knowledge is power.
The only thing I caution you, when you look at cancer statistics, they're looking back. So we're looking back at the last 10 years, what treatment was available 10 years ago. And so there's a lag time when we come up with the really great new treatments that we have, like Keytruda, that there's a lag time before we really start to see the benefit in the cancer statistics. So according to statistics, I should have been dead 3 or 4 years ago, but I'm not, because there's new treatments available that are very, very effective. I got into a clinical trial, got great treatment that way.
So that's important. The clinical trial part is important.
So if you look at a type of cancer that has affected a family member and you see a very bleak prognosis, I'm living proof. Don't listen to the statistics all the time.
And contact us directly if you're having an issue with that. We've helped a couple patients.
Yeah, we can help people find resources.
A couple of students whose parents had aggressive cancers, we walked them through it, and especially this part, the clinical trial side. Like Julie said, if she had not gone into a trial, if she had used what was quote unquote the standard of care of a combination of 3 chemotherapy drugs, there's a good chance she wouldn't have made it. Okay, But so go to the most best of the best medical center in your community, or even travel and find a clinical trial that best suits your type of cancer.
Mm-hmm.
And she finished her trial about 9 months ago, and
Mm-hmm.
it did really well. Didn't knock it out completely, but it was pretty well, and far fewer side effects, and importantly, it was more targeted to her unique mutations.
Absolutely.
Because like I said, the other treatments wouldn't have got it. And that's the new thing that's really, really cool in cancer. Okay, so that's what we want you to do. You can click right here on again, this is the statistical report that Julia was talking about. So I can click right here, and it takes you through, and you can just kind of walk through it, and you can look at the change. So you see that this is 2017. We're still gathering data to make the next report, but we can look at the incremental improvements that have happened going from 2013 to 2017. So we're seeing right here, in terms of the cancer stage, we've seen this great drop in all these different cancer rates here, men versus women, and then we see a couple that we need to work on. And maybe the next report things will be better. And so I'm not going to walk through all this, but that's what this is all about. And then what Julia did is she reiterated this. Read through this, simple reading, and then she put some of the important information about changes in rates. And as you see right here, and then some epidemiology. Like I said, it's environment interacting with genetics. Okay, and this is a big part of environment right here. Do you exercise? Okay, do you have excess weight? Because fat cells generate chemicals that can cause mutations in other cells, and so you got to improve your diet. Do you smoke? Right here, we see this down here. Okay, did you not get vaccinated against HPV? Okay, are you exposed to a situation where you're more likely to get Hep B and C? Yes, absolutely.
Okay. So every year I give a shout out to HPV vaccine, because having been diagnosed with cancer, if someone had said to me, "Hey, I can give you a series of 2 or 3 shots and you wouldn't have cancer," I would now say, yes, that's a great idea. So both of my sons have been vaccinated against HPV, and I know it's a controversial subject among a lot of people. However, in Australia, where they've made vaccinations or HPV vaccinations readily available, they're anticipating that the rate of cervical cancer is going to drop to 0. And it's not just cervical cancer in women, it's anal cancer, throat cancer in men. And it doesn't matter if you're, straight or gay or somewhere in between. It doesn't matter what your preference is. You can still get this cancer most of the time through sexual activity. So if you haven't been vaccinated against HPV, think about it.
In our small circle of people,
we know three people.
Right? We call her our niece, okay, Stacy. She had cervical cancer. Good friend of mine at USC had a pretty aggressive throat cancer.
And my actual niece had to have, I think she ended up having a hysterectomy because of, and she's relatively young, right, because of HPV related cancer.
So there you go. I mean, that's proof right there.
So anyway, get your shot.
Yeah, absolutely.
If you can.
Alrighty. And then it just goes through more epidemiology, looking at these, and so we've put this all out there for you.
Can you scroll back up?
Yeah.
Okay. Deadliest cancers for men aged 20 to 49, colorectal. Why is that? Colorectal cancer is very treatable when it's caught at an early stage, but people that are under 50 don't get colonoscopies. However, we also have a problem in our society with going to get health care and being honest with our doctors when we have problems. People don't want to talk about their poop problems. But if your choice is talking about your poop problem with a doctor and dying of colon cancer, you need to, if you're having symptoms, if you're having pain, if you're having constipation one day and diarrhea the next day, if you're having unusual symptoms, you got to be willing to talk about your poop and go to the doctor and get diagnosed early.
And again, this was very newsworthy recently. Chadwick Boseman, the Black Panther, You know, he just died of it, and he was a young man.
And very fit. So he
Yeah.
didn't have some of the indicators that we see. We're seeing increased rates of GI cancers among younger people because of poor diet and lack of exercise. And so this guy was young and fit and had everything going on, very successful, probably
Right.
had access to great medical care, but probably didn't get diagnosed early.
Right. So you can do everything right, but you can still have the mutations happen. It is what it is. You know, when we make these sweeping generalizations, millions of people, a lot of people are going to do everything right, you know, and you're still going to get it, you know. So, you know, so Julia, fit her whole life, exercise, good diet, you know, she's still got lymphocytic leukemia, you know, you put up your hands. We don't know, when she was a really, really young girl, she got Epstein-Barr virus, and it kind of was
Which
like,
most people do.
yeah,
It's mono.
but
you know.
but her genetics were probably wrong, so she got it more aggressively than most people do.
And I
so it
have
was
a
kind
lot
of like a canary in the coal mine.
Yeah,
You know? So,
I have a lot of cancer in my family, so it's no big surprise.
That's true, absolutely. Okay, so anyways, and then this is a reiteration from that link that I just showed you. So I'm not going to go over this, but you see that, you know, you're looking at 5-year survival rates, you know, and it's broken down here based on age, and we see again broken down based on ethnicity. Just we just want you guys to check this out, okay?
And we do see racial inequity between Black and white patients in terms of if both a Black person and a white person is diagnosed with the same type of cancer. In many, many, many types of cancers, the white patients are going to do better. And this can be access to medical care. It can be how well the treatment goes when they see a doctor. And so if you're thinking about going to medical school, you need to really pay attention to how you treat patients and how seriously you treat them when they come in and say, I'm having pain or something like that, some symptom that's troubling, because you don't want to be the guy that kills somebody because you didn't take them seriously. So,
and you can see right here the 5-year survival rate, okay? White versus Black patients, you see that, you know, across the board, white patients do better than Black, you know, and it's not genetics, it's mostly socioeconomic, okay, and being caught early because of access to better healthcare. And all right, cool. So all good things to think about. Okay, then we get down here. Okay, this is an incredible video, well worth watching. I'll turn it on right here. It's 12 minutes. Just kick back, have a cup of coffee, watch it. It gets into the nuts and bolts of how cancer is done, how cancer happens at the cellular level. And then this gets into what I was talking about right here.
Yeah, so we added these graphics to this section of the course because when you know, we look at our quiz questions and which questions people tend to miss, and people tend to miss the quiz questions about tumor suppressors and oncogenes. And I think it's confusing because your proto-oncogene is, you know,
it's a normal gene that we have.
And then it has to be deactivated to become an oncogene, which then puts the gas on the cancer and makes you have more cancer.
Yeah, so these genes are much more active. Grow, 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 more gas. Boom, boom. And then this guy, the tumor suppressor gene, is a gene that is, when it's active, it's getting rid of cancer cells. And when it becomes inactive, the most common mutation is, it's called a P53 mutation. So it becomes inactive, and suddenly you're not getting rid of the bad cells, and they just get passed on generation to generation to generation, and more cancer.
So when you have a mutation in your tumor suppressor gene that inactivates it, you're going to have no break, nothing protecting you from getting cancer. Elephants have many, many copies of the P53 gene in contrast to humans, and elephants don't get cancer, even though they live a long time.
Awesome animals.
I know.
Okay. Alrighty. So I always, encourage you to open your quiz at the same time and go through it. Okay. Then we have a special section on death and dying. If you've ever had I think it's the privilege of watching The Emperor of All Maladies. It's an incredible documentary. There is a section there where this oncologist is dealing with a dying patient, and she goes through the steps of palliative care, of preparing the individual for this inevitability. And so it's a very powerful phase of our life when we go through this. And so this is why we kind of want you to to go through this, and like I said, getting the C diagnosis, the cancer diagnosis is so scary. You start to question your mortality. How am I? And these thoughts go through when Julie got diagnosed. They're going to talk about the psychological process of DABDA, that we went through, and you kind of bounce all around through it. So it's denial, no way, anger, it sucks, you start bargaining. Well, if I'm a better person, will you save me? Okay. DABD, despair. I'm screwed. Okay. And one is acceptance, where you do this kind of end stage of palliative care, where you kind of clean the slate in terms of everything happening. So Julie has a.
So I also have a passion for the concept of grieving and death and dying. I lost my mom suddenly, going on 2 years ago in November, and she was a very healthy, vital, energetic person, and died in the middle of the night from a cardiac event. And it's going on 2 years, and I'm still grieving because we were really close, and I just thought she was amazing. And that's something that can happen when you get older. Your parents can become your friends, and you can have this amazing, wonderful relationship. So watch the video about the 5 stages of grief. Understand that it's not always a linear process. You don't always go, denial, anger, bargaining, despair, acceptance. You're going to hop back and forth, and not everyone grieves the same way. So at different ages, you're going to react to loss differently. And you may not have lost someone to death, but you may have had a disappointment. Certainly going through COVID and having the semester move online last spring and then again in the fall, there's a lot of grieving about that too. And grieving if you're a senior or if you're an athlete and you've lost your season. Those are all legitimate.
So this is not limited to death.
Yes.
This is the psychological process we go through with anything that gives you grief.
If you lose a friendship, so you're grieving the loss of a person who isn't dead, but you've broken up with someone, or you've lost a friendship, or you
never break up with me.
Never.
Okay.
Or your friend has somehow is unavailable to you. So there's so many different types of grief. And be patient with yourselves when you are having this grief. There's a 100 different ways to deal with grief. There's no right way. There's no wrong way. Just be kind to yourself when you're going through it.
Awesome. Very cool, guys. Yeah. So and I'm gonna at the same time just to prove her awesomeness, I'm gonna send out a video of from quite a few years ago when Julie first got diagnosed. I'm gonna piggyback it on this video, she, you think nobody's listening? She wrote a letter to President Obama about the Affordable Care Act and how important it was. And then President Obama's office called here and said, "We love what you said." And so he did a speech. And about 4 minutes in the speech, he talks about her. And the beauty of it is that he did not change a word out of what she had written, which was awesome. So I'm going to put that in there too, because she's awesome.
Definitely, since it's an election year, we don't get into politics, but what an amazing thing when we live in a country with 340 million people, and I write an email to the White House and the president reads it. That was probably the highlight of my entire life.
What about me?
Yeah, well, okay. It was, okay, you were first and then Obama was second. However, I write emails now all the time. I don't care if I agree with you politically or not. If I have an opinion on something, I'm going to let you know. Okay. So it just goes to show that each individual person can communicate something to a politician, and they might read your email. So if you're mad about something, let people know. If you're happy about something, let people know.
Okay. Well, I'm taking too much of your time.
Okay.
So you got to go lecture.
Yeah, I actually have to work.
All right, guys.
This is work too.
Yes.
All right.
So peace. We'll see you next time.
Right on, guys.
And don't forget to contact us if you have any issues ever about this kind of stuff. Okay. All right. And with that, I'm going to say goodbye.